Good evening, and thank you for joining us. I'm Kim Knox, President of the League of Women Voters of San Diego. Tonight's event is available in Spanish as well. We have several upcoming events to share with you. And one is Youth Incarceration, Prevention and Alternatives. That's Lunch with the League. So that's our lunch meeting at Tom Ham's Lighthouse Restaurant. It's Wednesday, October 4th at 11:30 a.m. We also have a candidate forum on October 18 at 7 p.m. That's at Cuyamaca College, and it's for San Diego County Board of Supervisors, District 4. Finally, we have Imagine a Day Without Water in San Diego County, a webinar on water costs and water availability issues. That's October 19 at 6:30 p.m. You can find more details for events on our website, and I'll put a link in the chat. The League is an all-volunteer organization, and we greatly appreciate the donations made during registration. For anyone who would like to donate today, I'll put a link for that in the chat. I will now pass it over to Ruth Sandven, co-chair of our Sustainability and Environmental Action Committee.
Thank you. Thank you for joining us this evening. I have the pleasure of introducing our distinguished panel. Dr. Wilma J. Wooten is a public health officer and director of public health services in the County of San Diego Health and Human Services Agency. She has been with the County of San Diego Health and Human Services since 2001, initially as a deputy health officer, and now serves as a public health officer since 2007. She has a strong interest in health disparities and health equity. Dr. Wooten is a current board member of the Public Health Accreditation Board of Directors. She also serves as chair of the Big Cities Health Coalition. Kristin Guirguis is a project scientist at Scripps Institute of Oceanography, whose research includes regional and global climate variability and change, weather prediction and predictability, climate and weather extremes, and impact on human health and society. Her projects focus on improving predictions of atmospheric rivers, heat waves, and fire weather in California on timescales important for emergency preparedness, resource planning, and the mitigation of health impacts due to weather extremes and climate change. Kristin VanderMolen is an assistant research professor at the Desert Research Institute in Reno, Nevada. She has a background in environmental anthropology and conducts stakeholder and community-driven research on climate impacts and adaptation, including information on health equity related to extreme heat and wildfire smoke. Alicia Espinosa serves as the Office of Border Health Chief under Public Health Services for the County of San Diego Health and Human Services Agency. She facilitates collaboration among local, state, and federal organizations working in the California-Baja California border region. She participates in projects ranging from emergency preparedness to mental health. The most important aspect of her job is building trusting and strategic partnerships with leadership in San Diego and Tijuana to facilitate cross-border collaboration. Just a reminder to put your questions in the Q&A, and the panel will address them after all of the presentations. Dr. Wooten, let's begin with you.
Well, good afternoon, and it is a pleasure indeed to be here with you today to share information about climate change as well as excessive heat, wildfires and air quality, as well as, I'm having a bit of an issue here, as well as vector-borne illnesses. My objectives in the next 20 plus minutes is to review what is the problem from a public health perspective and who is at risk. Then what are the impacts of extreme weather and climate change? And they are the three items or areas that I reviewed at the top of my presentation: heat, wildfires and air quality, and vector-borne disease. On the right side of the slide here, after we'll give you just some resources on what you can do, I want you to draw your attention to the fact that the Intergovernmental Panel on Climate Change, or IPCC, has recently issued some reports in the beginning of last year. This group is the utmost expert on climate change, and they have released 2 documents in February last year, the impacts, adaptation, and vulnerabilities, and in April last year, mitigation of climate change. So, as we stated, climate change has been identified by many entities to be one of the most important public health crises. From the World Health Organization, the Director General stated that climate crisis is a health crisis, and the same unsustainable choices that are killing our planet is killing individuals. And on the right side of the slide, Georges Benjamin, who's the executive director for the American Public Health Association, has also cited climate change as one of the most serious public health threats facing our nation. If we move to the next slide, even further, in 2019, a group, over 74 groups of organizations, including the American Heart Association, as well as the American Medical Association, came together to issue a call to action for government officials, businesses, social society leaders, elected officials, and candidates for office to recognize climate change as a health emergency and to work across governmental agencies and with communities and businesses to prioritize action on climate health and equity policies. In the next slide, this is a statement from the state of California in developing various plans across numerous sectors, from public health to transportation. For the public health sector plan, it was identified that the most immediate and concerning impacts for vulnerable populations continue to be extreme heat and air quality, as well as intermittent years of extreme precipitation caused by El Nino years, as well as prolonged drought. All of these entities are due to the extremes in our climate. In the next slide. So the question I ask of all of you is, and you can put your comments in the chat if you'd like, who is at risk for the impacts of climate change? Now, as you do that, I would wager to say that most of you will say that everyone is at risk, from the very young to the very old, to individuals that are isolated due to being elderly or having mental health issues or being homeless. Pregnant women, it doesn't matter what your race or ethnicity or your age or your gender, everyone is at risk due to the impacts of climate change. In the next slide, I'd like to historically go back to July 2006, when we had a very extreme heat wave here in California and across the nation. It was an unprecedented event, causing numerous deaths across the country. Specifically in California, we had anywhere from 450 to 600 people dying in a few days. 147 died specifically from hyperthermia, and all other deaths were due to exacerbation of their chronic medical conditions. Over 16,000 excessive hospitalizations occurred during that time. Now, if we go to the next slide, I want to share with you what we feel are some solutions and activities that the County of San Diego's Public Health Department has been doing over the past few years, since 2014, 2015. And the state of California adapted the Cal BRACE model, which is adapted from CDC. But BRACE stands for Building Resilience Against Climate Effects, and it has 5 components. The first, identifying the vulnerability of a particular region, then looking at the disease burden, followed by assessing what interventions can be implemented, and then developing and implementing a climate and heat adaptation plan, followed by an evaluation of these efforts. Now, in the next slide, we just want to bring attention to partnerships that have been formed over these past years. After receiving very modest support from the California Department of Public Health to implement Cal BRACE, we worked with many community partners, developed Climate Change 101 for our county staff, conducted surveys, and also one of the most important things that was developed was a vulnerability assessment by the California Department of Public Health. If we go to the next slide, you will see the first vulnerability assessment. It will be the next slide. Jump to the next slide. These are just our numerous partners. So this vulnerability assessment was conducted in 2016 across 3 different domains. The first domain is focused on environmental exposures in the green. The second is population sensitivity domain in the purple, and then the salmon orange color is adaptive capacity domains. So for the for the county of San Diego, because this vulnerability assessment was conducted for every county in the state of California, San Diego specifically was identified to have higher risk vulnerabilities for our county residents in the areas of heat and wildfires. Also, in the third domain, air conditioning or lack thereof, lack of tree canopy, and impervious surfaces, which is basically a description of environments that have a lot of concrete and lack of trees. Those were the 3 areas that were identified in the adaptive capacity domain. In the next slide, you will see that the state continues to conduct these vulnerabilities assessment, and this is from from 2021. We obtained this from the state's website. You can go to it. It's called CHIVIS, or Climate Change and Health Vulnerability Indicators. And in this particular rendition, there are approximately 20 various indicators that you will see on the far left. I apologize that they're a bit difficult to read, but the red line is basically the state's average. And any of those indicators that are above the state average are indicators that are important to focus on. And if we can see at the upper left-hand corner, the percentage of the high risk for wildfires is number 1, and the second one is impervious surfaces. So those are the top 2, and far beyond the state's average, designated by the line in red. In the next slide, speaking of air conditioners, the California Senate Office of Research conducted surveys, and as of 2022, only 56.54% of San Diego residents had air conditioning in their home. Almost 15% of residents own an air conditioner, and almost 42% have or reported that they had central air conditioning. So AC has been the most significant factor in reducing heat related morbidity and mortality. In the next slide, just want to draw attention to the concept of urban heat island effect. And basically downtown areas, because they have a lot of impervious surfaces and lack of tree canopy as depicted in the graphic, have the highest temperatures in the day as well as at night. Next slide. So this slide shows further information in terms of who's at risk, and this specifically speaks to occupational health-related illnesses. Heat-related illnesses. Heat-related illnesses were reported by California workers have increased from 2000 to 2017. On the graphic on the left, you can see that over that time period, individuals or occupations that were impacted or worked outside had a greater impact from heat and causing heat-related illnesses. In the right side, the state of California, you'll see that at the bottom there, Imperial County has the highest rates of heat-related illnesses per 100,000 workers, and that's followed by San Diego second and Los Angeles being third. Next slide. So this slide basically further defines the problem. And for San Diego, when we, as the local health department, wanted to focus on what can we do to impact climate change, we focused on those things that for which we do have a role. So when it comes to extreme heat, we have an excessive heat task force where we bring together over 20 departments within the county and 4 departments outside of the county to help address what will we do for our local San Diego County residents when we get the heat warnings from the National Weather Service. So that's one area that we work on continuously. Wildfires and wildfire smoke. The Public Health Department works collaboratively with the Office of Emergency Services when there are wildfires to provide services to the general community and track, working with the Air Pollution and Control District, provide information out to the general public on what they should do to protect themselves. And then last, the vector-borne illnesses caused by, again, extreme heats. The hotter it gets, the longer the life cycle for vectors can be, and the longer these certain vectors are around, the greater opportunity there is for the spread of disease. Now let's go to the next slide, and we are going to briefly go over those 3 categories: heat, wildfires and air quality, and vector-borne disease. In the next slide, next. So this slide is actually a California heat assessment tool. You can go to the CHAT website. It's a state website, and the link is on the PowerPoint presentation. This tool provides heat data that allows users to understand how extreme heat will impact communities across the state. At the bottom, it's a different rendition of looking at the impact of extreme heat by looking at extreme heat across healthy places index. And it looks at communities from lowest to the highest level of health. So you can pull up wherever you live based on the county that you live in and go and look at your risk for excessive heat. In the next slide, I just want to point out here that anytime during the given year we get heat advisories or excessive heat watch or an excessive heat warning from the National Weather Services. And over the past, from 2013 through 2023, we have identified these are the number of alerts that have been implemented, and you can see that in the more recent years, the numbers have increased, again, all due to climate change and excessive heat. Next slide. So this slide is basically research showing that when we look at the number of hospitalizations per summer, the thing I want to bring your attention to, if you look at the far left, California has the greatest number of hospitalizations, whether it's all-cause hospitalizations, cardiovascular related hospitalizations, respiratory, diabetes, or fluid and electrolyte disorders. The only one where California is not number one is the all respiratory related hospitalizations, which is the third one from the top. So California is where most of the burden occurs when it comes to excessive heat, and most cardiovascular disease hospitalizations also are seen in California. And the next slide. This is a lot of information when you get this. These are just the direct impacts of heat, from mild symptoms of heat cramps to more extensive heat exhaustion to severe heat stroke, which is a medical emergency, and individuals should be taken to the hospital because in this particular case, in this particular situation, people stop sweating and they are dizzy or may pass out and become unconscious. And in this particular situation, you do not want to make people drink water if they are conscious. It's about cooling the body down and getting them to the emergency department as soon as possible. In the next slide, the heat stroke can damage 3 important organs: the brain, the heart, and the kidneys. And those individuals, as we stated earlier, that are most vulnerable include those individuals that are very old, in poverty, or are isolated due to mental illness, age, or homelessness, and individuals that have pre-existing and chronic conditions. In the next slide, another important factor is medications, and any of these medications can increase one's risk for heat illness because many of them cause dehydration of an individual. Next slide. So the next area is wildfires and air quality, and that will be followed by vector-borne diseases, and my time will be up. As it relates to wildfires and air quality, in the next slide, these are heat maps, and this is another tool that tells you your if the area that you live in, if it's a fire hazard severity zone. And these were generated by supervisorial districts in San Diego County. So we here have District 2 and District 5. The severity zones goes from moderate to high to very high, which is in the red. And you can see that District 2, most of this population, because it's mostly inland, but most of this jurisdiction is red. So a very high severity zone. And the same thing with the District 5. You see a lot of red there as well. Next slide. So this is a San Diego vulnerability to air pollution. It's called Cal EnviroScreen 4.0, and it is looking at the propensity for detecting particulate matter 2.0 in the areas that individuals live in. And the box at the bottom left there is mostly San Diego County, and you look at the legend there. So from the kind of dark blue to light blue, it tells you what your vulnerability to air pollution is. Next slide. And again, you can access all of these on the web. In this slide, our Live Well San Diego indicators, one of those indicators is specifically air quality, and air quality is measured as the ratio of days that air quality is rated unhealthy. And in San Diego County, the air quality was rated poorly on 13.4% of the days in 2020, which was a total of about 49 days for that year. And you can look at the bottom, it shows the trend over the 10-year period from 2010 through 2020. Next slide. Now, I mentioned particulate matter 2.5 and the heat impacts. Basically, particulate matter is very small, so small that it can go past the nasal cavity and into the lungs. And It is well documented that this type of particulate matter can cause pulmonary inflammation that can reduce lung functions through bronchoconstriction, as well as alteration of the pulmonary immune system. And the particulate matter is as fine as the diameter of a shaft of hair or grain of sand. Next slide. So this is additional research that was conducted here at UCSD and concluded that wildfire-specific PM 2.5 is up to 10 times more harmful to human health than particulate matter of that same size from other sources. Next slide. So lastly, vector-borne diseases. If we go to the next slide, we're going to focus on mosquitoes. There are many different types of vectors, from ticks, but our focus for the purpose of this presentation will be on mosquitoes. Next slide. This next slide shows a myriad of different types of vector-borne diseases, some of which are also caused by mosquitoes. Of note, West Nile virus showed up in San Diego in 2003. And then we had Zika virus, which we started seeing cases in San Diego, not endemic, but people had traveled to endemic areas, returned to San Diego. And because the mosquito that transmit this disease had landed in San Diego in 2014 and 2015, if individuals were infected in other areas outside of San Diego, in other countries, came back and they had these mosquitoes in their backyards, our county was at risk for spreading Zika. So the public health department works very closely with the Department of Environmental Health to conduct environmental scans for these mosquitoes if an individual was diagnosed with Zika and contracted it from another country. In the next slide, just want to show, these are just headlines showing information about various vector-borne illnesses. Our health department conducts an annual vector-borne and zoonotic disease meeting for our healthcare providers. The last one was in June of this year, and the next one will be next year. The 13th annual meeting will be held next June as well. Next slide. And then I talked about, this is the Aedes aegypti mosquito, occurred in San Diego, was detected in San Diego in 2014, and the albopictus in 2015, and then the Aedes nodoscriptus in 2018. Next slide. I think this will be my last slide. This shows where the Department of Environmental Health and Quality has identified particularly the Aedes aegypti and the Aedes nodoscriptus. So with that, I have a couple of additional slides after this one that just provides you with information on what can you do to address climate change. This is a big issue, but everyone, if they can identify one or two things that they can do in the next slide, we encourage you to do that. So we have about 9 different actions that individuals can take. And second, my favorite is the planting trees. If you can plant trees in your neighborhood or your community, but also doing other things to decrease the footprint, the gas green, the carbon footprint in our communities. And the next slide is the last one, and now we'll turn it back to our facilitator. Thank you.
Dr. Wooten, thank you so much. Let's now hear from climate scientist Kristin Guirguis.
Hi, everyone. Okay, I'll pull up my slides now. Should be more prepared. Okay. So yeah, I'm Kristin Guirguis. I'm a project scientist at Scripps, and I'm happy to be here today for this discussion. So today, I'm just going to talk about some of the work that I do at Scripps. So I study weather extremes and climate change, and I also have collaborated with epidemiologists to study health impacts associated with heat waves in California and in San Diego. And so here are the types of things that that I study along with those in my group. These are, weather phenomena that are important for our region. So of course, heat waves, which is an important topic today, and also marine layer clouds, which are important for modulating heat waves and their impacts at the coast, and Santa Ana winds, precipitation regimes and extremes, as well as atmospheric rivers and droughts and floods. And then, of course, what we care about is the impacts on society. So I'll start out talking a bit about this heat wave. Dr. Wooten also discussed it. It was a very impactful heat wave in 2006, and it motivated a lot of research on the topic. And Dr. Wooten highlighted the health side of those statistics and those outcomes and some of those disparities. On the climate and weather side, what researchers found from studying that heat wave is that one of the things that made it so dangerous and impactful on human health was that it was very humid. Historically, California has had these more, dry types of heat waves where it'd get really hot in the daytime, but then it would cool off at night, so your body would have a chance to recover. But that didn't happen with this heat wave. It stayed, pretty hot at night. And so the research found that a trend was emerging where heat waves were becoming more humid, and so they tended to manifest themselves very, very strongly at night. So when we talk about daytime and nighttime heat waves, the heat wave lasts day and night, but it's the temperatures were more extreme relative to average when you look at the nighttime temperatures. So then looking at this in terms of looking at observations, one of the questions was, are these trends something that's going to continue in the future? And so this is showing some results from that paper where you can see this increasing trend in the small graph in the center is showing the observed record at that time. And this shift to the blue colors just means that heat waves are changing in their characteristics to become more humid. And you can see when you look at the climate model projections, not only are heat waves becoming more intense, more frequent, but they're also becoming more humid. And that's important because humidity interferes with how our body cools down. It interferes with our ability to kind of perspire, which is one of the main mechanisms that helps us cool off. And this is just a little illustration from a report that was done by the San Diego Foundation and researchers at Scripps looking at climate projections for the San Diego region. And this is just illustrating, the difference in historical heat wave activity. So this is, how many heat waves we had on average pre-2000. We might have 2 days that were considered a heat wave that were extremely hot. And so if you look forward to mid-century, which this report was looking at 2050, which seemed farther away then, but it's looking pretty close now. You can see that we expect about 15 days now on average, which is, a big change. And so this highlights the importance of, effective adaptation strategies that Dr. Wooten mentioned, and also, of course, importantly, would be mitigation efforts to try to, reduce the number of heat waves that we do experience in the future. So this is looking at some of the research that I worked on with some colleagues and the California Department of Public Health, and we looked at different types of outcomes, including heat illness and dehydration, but also some of these other pre-existing conditions like cardiovascular disease and respiratory disease and things like that. And in our study, we found over 11,000 hospitalizations due to extreme heat exposure during this 10-year period between 1999 and 2009. And one of one of the things we've also looked at is how our local climatology affects our ability to adapt or acclimate to extreme heat. And San Diego is an interesting region to look at that because we have such a diverse climate over a relatively short spatial distance. As we know from living here, we have this cool coastal region, and then in a very short time we can go inland and even to desert communities within San Diego. So if you look up at the top left-hand side, this is showing how dramatically temperatures vary across the county. We have very cool conditions typically during May through October along the coast. You can see the blue dots. It's in the 70s, but then it gets much hotter as you go inland. And so then this translates to air conditioning access for San Diego residents. And Dr. Wooten talked about the importance of air conditioning in terms of protecting us from morbidity and mortality from heat. And you can see that along the coast, air conditioning access is not very common. You can see in general, less than half of the coastal population has air conditioning in their homes, and it becomes much more common as you go east. And also, interestingly, if you look within the coastal region, you can see disparities in air conditioning access. For example, you can find that higher incomes within these coastal regions are more likely to have air conditioning in their homes. And also homeowners are much more likely to have air conditioning than renters, for example. So there's within these regions, there's also disparities in who has access to these technological adaptation. And that is an important risk factor when we do get a heat wave. And this is highlighting how the different populations within these three regions respond to heat. What this is showing, so here along the y-axis is a risk ratio. So we were using hospitalizations to measure a risk factor for heat exposure in terms of the number of hospitalizations at different temperatures for these two regions. And the little red dots, that means that's where we detected a significant increase in hospitalizations. So what's interesting is in the desert regions, you can see that this risk emerges at a much higher temperature, say temperatures in the 90s, for example, compared to inland or coastal populations where the risk emerges at much lower temperatures. And that highlights how, we tend to adapt and acclimate to our average conditions. And so we're just not used to this extreme heat, so we can feel this burden. And coastal populations are found to be more at risk for this reason. And I wanted to touch a little bit on some other types of changes that we expect in future climate that are important for San Diego. One of them is precipitation regime change. So this is from research looking at precipitation in San Diego and California and behavior of atmospheric rivers and that kind of thing. And what the research suggests is that in the future, we're expecting to have fewer rainy days, but when it does rain, we expect that the storms will be more intense and carry more water. And this is because, a warmer atmosphere is capable of holding more water. So when it does rain, we tend to get more of it, even though there's more dry days in between. So this is a summary of that. So fewer rainy days, but stronger when they occur. So your risk of flooding increases. Because there's more dry spells between, that affects, our buildup of pollutants and entering stormwater, and then the potential for enhanced drying of vegetation between events. And California's rainy season coincides with the Santa Ana winds. So Santa Ana winds here, this is showing the frequency for different months of the year. And so there's a peak in December. So it's really a winter type of weather phenomenon. And this red means that's the more intense Santa Ana winds. So the timing of winter precipitation relative to the Santa Ana winds is really important, because if Santa Ana winds occur when the vegetation is wet, then our risk for wildfire is much reduced. But if they occur during when the fuel is really dry, that's a major fire risk. And so what the research suggests is that with this shortening of the wet season, there's a greater potential that Santa Ana winds will interact with dry vegetation. And so to end, I wanted to highlight some literature that we have at Scripps as part of the California Nevada Applications Program. They put together a lot of these neat handouts on different weather and climate topics that might be of interest. They're all very short. And then also this report on San Diego County ecosystems. So for those of us interested in how climate change is affecting our natural environment and plants and animals in San Diego, this is a nice resource. And then to end, I just wanted to highlight another project that we're just starting at Scripps. It's a collaboration with educators and community organizations and nonprofits. It's called the Southern California Heat Hub, and it's focused on kind of collaborative research with a big focus on interaction between like atmospheric science topics and also urban greening, and trying to understand things like the water needs of trees and some of these solutions that will be important in the future. And that's the end of my presentation. So thank you all for listening.
Well, thank you very much, Kristin. Very interesting. And let's continue with Kristin VanderMolen with the Desert Research Institute.
Okay, great. All right. Well, thank you, everyone. I am going to speak briefly about two related projects that are focused on understanding how to increase the reach and effectiveness of heat risk education and warning messaging based on recommendations specifically from San Diego County residents. Both of these efforts are funded by the National Oceanic and Atmospheric Administration, NOAA, through the two programs listed below. So the recommendations that I'll be sharing were elicited during 4 focus groups conducted across San Diego County in 2021. And you can see the breakdown of participants across the 4 focus groups, but they included community leaders and advocates, nonprofit and community-based organizations, county and city government agencies, healthcare professionals, schools and universities, and a utility company. And though focus group participants were clearly joining from diverse professional backgrounds, one important thing that they all had in common is that they all represented or worked in some way with diverse communities across the county. So there were 4 questions that guided our focus group discussions, including: is heat a health concern in the communities you live in or serve? What, if any, heat risk education and warning messaging programs exist in or reach those communities, and what is their effect? What opportunities and barriers exist for communities to protect against heat, and how can the opportunities be fostered, and what is needed to overcome the barriers? And the recommendations that I'll talk about came out of our discussions around that second question. And the reason being that focus group participants were largely unaware of efforts around heat risk education and warning messaging in the county. And yet certainly such efforts do exist. So given the presence of those efforts and the fact that people were largely unaware of them, we spent a lot of the time during the focus groups hearing recommendations from participants about how specifically we could close that gap. So there are 3 overarching recommendations, and I'll touch on them here briefly and then talk about each one in a little bit more depth. But those are to diversify communication channels, to create specific, comprehensive, and accessible content, and to conduct formally coordinated heat risk education campaigns. And I'll note that all 3 of these recommendations were very much rooted in the local knowledge and experience of focus group participants. So for example, it was not the case that we had focus group participants that happened to have a background in hazard risk communication, or that had even worked extensively within the realm of heat and health. And at the same time, all 3 of these recommendations align with documented good practices in hazard risk communication. So what seemed logical to do from the perspective of focus group participants also happens to be what research suggests will be effective. So again, the first recommendation was to diversify communication channels. And the idea here is that those organizations that are involved in efforts around heat risk education and warning messaging in the county should collaborate with organizations and individuals that already have established trusted relationships with communities so that they can ensure that their efforts reach them. And when we asked focus group participants for examples of those types of organizations and individuals, they listed nonprofit and community-based organizations, neighborhood schools, peer trainer and health outreach and engagement programs, and community and religious leaders. So the idea here again is that because those organizations and individuals have established trusted relationships with communities, they speak the languages of the communities, they are culturally competent, they're exceptionally well positioned to be able to serve as intermediaries effectively and facilitate the exchange of information between those 2 groups. So between communities themselves and organizations involved in heat risk education and warning messaging. And focus group participants talked about doing that in a couple of different ways. One would be to become educated about heat risk themselves and efforts that exist within the county so that they could then connect communities to those efforts. Another would be to connect people from the organizations involved in those efforts directly with the communities. For example, creating opportunities for subject matter experts to come in and interact with community members directly. The second recommendation, again, was to create specific, comprehensive, and accessible content. And some of the specific suggestions here relate a little bit more to education, some relate a little bit more to warning messaging, but ultimately are applicable across both. So under specificity, one suggestion is to make clear which populations or geographic areas are most at risk and why. And this really reflects broader understanding of the importance of including information like population, geographic, and temporal specificity in hazard risk communication in order for people to take it seriously. Also, to be explicit about the potential health impacts and their symptoms to at-risk populations. So recognizing that often people who are at risk don't know that they are at risk. And so in communicating about heat, it's important to specify who specifically is at risk and to help people see themselves as part of those groups, and also to help people know what to do. With respect to comprehensiveness, the suggestion is to provide clear actions for mitigating potential health impacts, including at individual, household, and community levels. The idea here being that an uninformed public won't necessarily know what constitutes protective action. And so it's important to help people understand what to do and also why they should do it. And then with accessibility, the recommendations were to use different languages and formats, including things like storytelling and short video to ensure information equity, and to be culturally competent to enhance information uptake. So to ensure that the information is appropriate and that it will resonate with its intended audience. And then that third recommendation, again, is to conduct formally coordinated heat risk education campaigns. And overwhelmingly for focus group participants, the idea is not that there just be one campaign at one moment in time, but rather that heat risk education campaigns recur annually. And we asked participants to kind of map out for us what they thought a campaign might look like. And this is a high-level overview of what they came up with. So in winter and early spring, the idea is to create opportunities, training opportunities for trusted organizations and individuals to become educated about heat risk and integrated into existing communication channels. So that gets back to that first recommendation to diversify communication channels and bring trusted organizations and individuals into the fold as intermediaries. In spring and early summer, to utilize the expanded communication channels to offer heat risk education to communities and potentially at-risk groups. So this gets back to the first and second recommendation, again, leveraging the diversified communication channels and giving attention to recommendations for effective content in informing education activities with communities and at-risk groups. And then in summer, continuing health outreach and engagement, utilizing the expanded communication channels to reinforce education and learning over a longer time frame. So having heard these recommendations, we're now working to implement and evaluate some of them, starting with the notion that if trusted organizations and individuals are going to be incorporated into the fold and serve as intermediaries potentially, that there is a need for them to become educated about heat risk and also for them to have resources available to them to teach communities about heat risk. So we are currently developing a heat risk education curriculum for San Diego County peer trainer networks. It's a large group that's involved, and in the interest of time, I won't read through the names and organizations, but I'm sure that some of them will be familiar. And this curriculum includes 6 modules, a facilitation guide, and handouts for learners. And the 6 modules cover background on heat waves, heat illnesses, including symptoms and treatment, at-risk groups, heat illness prevention, community action around heat risk, and community strategies. And the curriculum and supplementary materials were originally created in English. They have since been translated into Vietnamese and Spanish, as you see there, a sample slide from one of the modules, and they're currently under evaluation. So we're working with an additional set of community-based organizations, some San Diego County government agencies, and the League, actually, to evaluate the effectiveness of the curriculum in educating communities about heat risk and ultimately motivating them to take protective action. Once we finish the evaluation of the curriculum, it will become publicly available probably sometime early next year. Thank you.
Thank you very much, Kristin. So now let's go to our Border Health Chief, Alicia Espinosa.
Thank you, Ruth. Let me try to share my screen. Okay. Just a second here. Can you all see the PowerPoint?
Yes, we can see it. Thank you.
Okay. Thank you once again. So I'm going to talk to you about the Partner Relay Communication Network and specifically strategies for improving communication with diverse language communities during emergencies. And so we'll go into the why, we'll go into what the program is, and then some actions that you can take. And so we already know that San Diego County is a very diverse county, 3.3 million residents. It has one of the busiest borders in the world. It's home to not only a diverse population, but also to diverse landscapes with beaches, deserts, great weather, which puts our region, it's no stranger to a variety of natural disasters, as we've just learned. So the county has a live well strategy, which are 3 strategies: building better health, living safely, and thriving. And living safely is the one that the Partner Relay Network really falls under. The focus is to ensure that communities are resilient to disasters and emergencies, and broadening our view of safety to facilitate how we interact with our residents and provide information that enables them to be proactive in their own safety. So what is the Partner Relay Program? It's an initiative to improve communication with limited English proficiency communities during natural disasters and public health emergencies. It is a county community collaboration coordinated by the Office of Border Health and Public Health Services and the Office of Emergency Services. We have 4 main objectives, which are to provide vetted county incident information to the Partner Relay Network during natural disasters and public health emergencies. We also host quarterly emergency preparedness and public health trainings for partner agencies. We conduct drills for partners to practice using online communication platform, as well as get information on different public health and emergency disaster preparedness. And mainly, we create a network of trusted community stakeholders that share information into various languages to the communities in which they serve. So as I mentioned, we do partner with the Office of Emergency Services. And so what is their role? It's to coordinate the overall county response to disasters, provide alerts and notifications to appropriate agencies when disasters strike, ensuring that resources are available and mobilized, develop plans and procedures for response to and recovery from disasters, and develop and provide preparedness materials to the public. And so the Office of Emergency Services is very key in providing those messages that are accurate, trusted, and then the Partner Relay Network takes that message and distributes it through our communication platform, which is Slack. Oh, I'm getting ahead of myself here. Let's start with the SD Emergency app first. The SD Emergency app was developed to be able to share some of these emergency key messaging where there might be an excessive heat warning. You can see some of the examples on the screen here where there might be a flood warning, if there's any evacuation procedures that need to take place. In addition to receiving emergency preparedness information in English and Spanish, you can also develop your own personal disaster plan in the app. It's very comprehensive. And so here's just a few other examples of what is available to do in the app. So preparing for disasters, making a plan, building a kit, staying informed, different ways to get involved. There's different emergency maps, shelters. There's the Shake Ready SD, which focuses on earthquake disasters. There's also recovery, so local resources, assistance centers. And the app is available on Android and iPhone. So it offers both. And so the app was really designed for this Alert San Diego program that took place. It's the San Diego Regional's notification system. And then most recently, in addition to American Sign Language, we've also included Spanish, and we're working on different languages. And so this is a great resource to have in your pocket and just receive notifications that are specific to your area. So what are some actions that you can take if you are a community organization, a nonprofit, school district, hospital? There is a QR code on the screen. So you can join the Partner Relay Network of trusted community stakeholders. And so you would receive these messages through the Slack platform, which is an online communications tool, and or via email. So then as a partner, you would then take that vetted disaster public health information and share it with the communities in which you serve. We also have different presentations or booths that we can facilitate if you have an upcoming event to share information directly with the community. There is also quarterly trainings that we host for all of our partners or anyone that would really like to join and just get information on upcoming current public health emergency preparedness information. And so we have a small but mighty team. On the left is Victor Ruiz, and then on the right is Juliana Piceno with the Office of Emergency Services. And so this is just an example of us being out in the community and sharing some of the personal disaster plans and partner relay information. And so what can you do if you're a resident? You can practice using a personal disaster plan. These plans are offered at no cost through the Office of Emergency Services, and prepare for, respond to, and recover from an emergency or disaster. And then practice this plan with yourself and your loved ones at least twice a year so that you can be ready should any disaster strike. We have some references and then some contact information if you're interested in learning more about the Partner Relay program. We do have over 700 key partners, but due to COVID, it did slow down. So we're in that process again of being in the community, connecting with partners and stakeholders and residents, and just seeing, who else can join that network so we can reach more residents that need to receive these messages. And that concludes my presentation.
Thank you so much, Alicia. We've received a lot of important information here tonight. I'd like to introduce the co-chair of the Sustainability Committee, Mary Lou Lindegren, who's going to help moderate some questions. We've got about 15 minutes. We can answer some of your questions.
Well, thank you. These are great questions we're getting, and you can look at these in the Q&A box. I'm going to start with two that have been answered already. So go into the answered program, because I think everyone would benefit from these incredible responses from Dr. Wooten. But the first question really has to do with the Cool Zone program in San Diego. Specifically, where are the cool zones? What are their hours? There was some concern about what to do on a weekend, since some of them are libraries and they're not open 7 days, and also transportation to the cool zones, and some of the concerns about library air conditioning may not be as functional as we would like. And Dr. Wooten has answered this, but I'm going to open it up to her if she'd like to either read her answer or just talk a little bit about the cool zones for the group. I don't know, Dr. Wooten, are you still there? You're on mute. Well, I'm just going to go ahead and read her response. So
Can you hear me now?
oh yeah, yes, I hear you now.
Yeah, I was locked out there for a moment. I can't navigate at the bottom. Okay, there we go. So in San Diego County, our Cool Zone program occurs every year from June 1st through October 30th. Now, some of it, it used to be a point where our excessive heat was usually in October, November, but now we had an early heat situation in February of last year. So I'm trying to pull things up here. Sorry, I'm having technical difficulties. But there are over 100 cool zones throughout the county of San Diego, going in places like community centers and county libraries, as well as city libraries. And we're always trying to get more facilities to sign up as cool zones. Now, there was a question about transportation in the Q&A or the response. We now have a transportation program. If someone does not have transportation, they can, there's a number, they can call 211 and they can get transportation or shared ride service at no cost to a cool zone that is near them. And then for individuals that are homebound, our Aging and Independence Services provides fans for those individuals. The caveat there, however, is that fans don't really help if the temperatures are over 90 degrees in the homes. And then regarding libraries being open in the evenings, we do expand or extend evening hours in libraries, particularly in the rural areas, when we are in what's called phase 3. And that's usually when the temperatures are beyond 110 or 115 degrees. So that is the process for when we would extend the hours in our libraries.
Oh, thanks very much. That's really critical. You can actually, there's a link in here to find more information about the location of the cool zones. And I encourage you to look at that.
Mhm.
There's also another question for the county about that you've answered beautifully. I just want to point out to people the program to reduce urban heat islands. And this has to do with planting trees. Dana pointed out, I think the New York Times article just came out today on actions being taken in Singapore to counteract these impervious services in urban heat islands. But Dr. Wooten, can you just briefly talk about the tree planting program?
Yes, that's a program. It's not in our department, but it's through the Land Use and Environment group. And apparently, I put the link in for the website there as well too, that this program has been going on since 2017. So we can get further or additional information. I'm not aware of what the numbers are as of today that have been planted since then, but there are metrics that our Land Use and Environment group is following.
Great, thank you. I think this question is for Kristin, and it has to do with heat warnings not being received by landline phones, even though they should be part of the emergency database. Similarly, no hurricane, even though I think we just had one hurricane, maybe we'll get more. Similarly for the hurricane warnings. Can you talk a little bit about what is done for landline phones?
I wonder if that's a question actually that Alicia would be able to answer. I'm not familiar with the technical ins and outs of some of the emergency alerts in the county.
Okay.
No, I'm not sure specifically to landlines. We do promote the SD emergency app. That way it's on your cell phone and you have access to it, you know, whether you're in bed or somewhere else. And so you can access it at any time or driving. And actually, something just came in right now. So I had my staff triage that, and that's what's great about having a team, right? That we can put things not only through the SD emergency app, but then that trusted network of community partners will receive the same message via email, and then they'll communicate with the residents or that specific city in which they know the platform is that they usually communicate, whether it's via text, whether it's a phone call, whether it's an email. They would know what is the best way to reach those members. So I didn't quite answer your question directly. I'm unsure about the landline, but if there's any chance that you do have, you know, some type of mobile device that you can download the SD emergency app, that way you have access to it at your fingertips, you know, no matter what you're doing. But I will look into this because now I'm curious.
Great. Dana asks, are there any labor actions or new OSHA regulations for outdoor workers, such as those working in agriculture or construction? I'm not sure who is best to answer that question.
I think we'd have to get back to the person, because I'm not familiar with all of the those regulations, but it's certainly something we could research and provide an answer at a later date.
Okay, thank you.
Okay, here's my favorite question, and this is going to be for anyone to answer. It is, should the U.S. declare a national climate emergency? And if you're familiar with what a national climate emergency means, please help us with that as well.
Well, this is Dr. Wooten. I think it is very clear that all the national organizations associated with health and climate change have indicated that climate change is a public health issue. Usually when a declaration is declared, there is an anticipated end. And so if that were to happen, then we would continuously be in an emergency. So I don't see that would happen at this point in time. As you have seen with emergencies being declared for, say, COVID, or for H1N1 when that occurred, or for monkeypox even. So I don't think that will happen, is the bottom line in my answer there.
Does anybody else want to weigh in on this? I know that FEMA declares emergencies for other climate-related disasters, and maybe Kristin Guirguis can weigh in here, but it has not included heat as one of those climate or weather-related emergencies, even though it's the #1 cause of death from weather-related emergencies. And if FEMA was able to declare an emergency, then resources would be available to address the extreme heat. So maybe others can weigh in on this too. Is there, how do we get more resources for these events? And is declaring an emergency with heat, extreme heat, one of those tools?
Well, Mary Lou, as you've stated, when there is a disaster like a hurricane or a tornado or floods, there are local disasters and in some cases state disasters declared. And the question specifically says declare a national climate emergency. And I go back, I stand by my answer that I don't think that we will see a national climate emergency declared, but if there are particular incidents that occur as a result of climate change, like wildfires, that occurs when we have wildfires, or floods, or tornadoes, or any weather related conditions. Usually disasters are declared when there's something happens and then it resolves, or it's over, and then you have to do the response and cleanup afterwards. That's usually how the environmental type disasters are declared. But for something as it relates to climate change, which is ongoing, you would never end the disaster or the emergency.
Right. Okay, thank you.
We have another question. An anonymous asks, has the county allocated funding to address the health risk inequity in the county?
I need a little more information. There are a lot of health risk inequities, and we certainly saw that with COVID-19, and there was federal funding because there was a national, a state, and a local emergency. And equity was at the core and foundation of how we responded to testing, to vaccinations. But currently, again, because with COVID-19, because it was an emergency, there was funding. So unless there was an emergency for I guess climate change, you would have to see the emergency established, then the funding to go towards it. So there's a process of how that occurs. And in the current situation, our focus is just trying to identify what are those areas and needs for situations like excessive heat. And you've heard about the Cool Zone program. You've heard about the partner relay program, trying to reach individuals that have limited English speaking proficiency. So we have many programs that try to address the needs of those that are at greatest risk.
Thank you.
Okay, this is a question from Jennifer about whether the county can install solar for those buildings which are designated as public cooling stations. Otherwise, we continue to heat up the planet as we work to mitigate the health effects of climate change. An important message for our community is that retrofitting offices, homes with AC needs to go hand in hand with the addition of solar power. I guess, Dr. Wooten, this is back to you too.
Well, you know, I work for the public health department, so I don't know all of the ins and outs of what goes on in other departments. That's certainly a question that can be posed to you know, it's a question that can be posed, and we can find out. The question has been posed, has been asked, and we will go back and try to find the answer.
Great.
And I mean, many county departments have solar, have departments. I would say buildings, not departments, but there are several buildings on the COC campus, for instance, that has solar panels, but I don't know where every building that's part of the county enterprise would have, whether they have them or not. So that's something we would have to get back with you on.
Thank you. I think we have time for one more question and answer. You have one last one, Mary Lou?
Let's see. This is interesting. We have an interesting anonymous attendee, but whoever this is, I'd like to meet them. Are there any discussions of having the cool zones be more broad resilience hubs in San Diego?
I don't understand the question, sorry. Broad resilient hubs, what do you mean?
I'm not sure what the questioner meant, but I think there is some discussion about making these cool zones broader in terms of what they may offer the communities, if I'm interpreting this correctly.
Well, the cool zones are intended, these are existing locations where people can go and get out of the heat. Libraries are always great because you can go in, you can read or you know, spend time there if you do not have a location that you can protect yourself due to the excessive heat. But so they're existing locations. They weren't specifically built to be a cool zone, but they are existing locations that provide air conditioning where people can go. So that's a very interesting concept and question. But the existing program is intended to have locations that can provide the opportunity for people to go. And we as in the county, Aging and Independent Services is always looking for additional locations to come on board to provide that opportunity to people to get them out of the heat.
Yeah. Thank you. I know some of the cool zones are also held in recreation centers where people can actually also bring their pets.
Yes.
That's a
and there are some cool zones where that are pet friendly cool zones as well too, and that's on the website. So you can go to the website and identify areas like the closest cool zone to you, for instance, and you can also look and determine which ones are pet friendly.
Yes.
And I don't know, Dr. Wooten, you have a couple of slides with a lot of resources on them, and maybe, but we're like toward the end of the program. But I thought maybe if I don't know if Kim still has your slides, we can put those up while people are signing off, and you can see these will be available online, but there's like 3 pages of incredible resources that Dr. Wooten had on her slides.
Oh, absolutely. The last 2 slides that I covered during the presentations, or what can individuals do? And then there are additional resources at the local, state, as well as the federal level. A lot of those hot maps and the tools that were embedded in my PowerPoint presentation, there's links to those in the resource section as well as the slide. But there's numerous resources provided in the last 10 pages of the PowerPoint. So you can send it out as is, we're okay.
Yeah, I think sending it out would be the best so people can just click on those links.
Sure.
Well, I'd like to thank all of our panelists for this evening. Very informative. I learned a lot. I would like to thank our audience for your questions and your participation, and for attending another important League of Women Voters San Diego event. Thank you, everyone, and good night.
Thanks, and thank you to our interpreters, Mario and Andrea. We appreciate you. Have a good night, everyone.